Welcome to Get Schooled on COVID and Get Schooled on Concussions. I'm Dr. Karen McAvoy, and as a school psychologist of 30 plus years, I am here to talk about how a multitude of medical and psychological issues like COVID-19, like a concussion, or like trauma, can impact learning in our students for days to weeks to months. So, are you ready to get schooled? The past 2 years have been tough for schools. We have had to navigate students through remote learning, being out of school due to exposure, and now students returning to the classroom post a positive diagnosis of COVID-19. Besides missing instruction, we now know that students who have contracted COVID-19 can actually be having neurological changes in their brain that is making learning more difficult for them. We call that brain fog. The CDC lists brain fog as one of the numerous symptoms of COVID-19. It is described as difficulty thinking and concentrating, affecting potentially 67% of those diagnosed. As a brain injury researcher and clinician of 20 plus years, brain fog sounded very familiar to us at Get Schooled on Concussions. That's because having mental fogginess is a very common symptom post-concussion. Just look at this Venn diagram and see how COVID and concussion symptoms overlap. While we're learning much more about COVID-19 every day, we do already know a lot about the neurological impacts on learning from all of our concussion research. For example, we know that if you hit your head or shake the brain in the skull, you can end up with a diagnosis of a concussion that leads to physical, cognitive, emotional, and sleep symptoms. Well, COVID-19 has similar symptoms in these 4 exact same areas. With COVID-19, we do not yet know what causes brain fog, but there are many theories about possible infection or inflammation of the brain cells, or lack of oxygen, or a possible autoimmune response. So what are the lessons learned from concussion that we can now apply to COVID-19? Well, let's think through the similarities. With both COVID and concussion, students are out of school and miss instruction for a number of days. They return to school feeling physically lousy and cognitively unavailable to learn. Because of brain fog, they both have difficulty processing and remembering efficiently, and that makes all learning harder and more taxing. And while many students with concussion will resolve within a month, we don't know how long it will take for students with COVID to resolve their cognitive inefficiencies. But we are aware that there are cases of long COVID where persistent cognitive symptoms can last for months. When you think about it, we as educators know that brain fog actually is a common symptom that comes with many different medical and psychological conditions, right? Not just with COVID or concussions. Students who are traumatized, or students who return to school after the flu, mono, or stress, or chemotherapy, can have trouble learning, keeping up with work, and often have mood and behavioral changes. So if we want to help our students with concussion and COVID-19 get better as soon as possible, where do our academic supports really need to be? Yes, in your general education classroom. We want to put in place quick, flexible academic adjustments and not let issues rise to the level of academic accommodations as in a 504 plan or academic modifications as in special education. And while we know that students who play sports run a higher risk of getting hit in the head and suffering a concussion, which is why by 2014, all 50 states and the District of Columbia passed return to play legislation. New research shows that for every athlete who sustains a concussion in sports, another student sustains a concussion in a non-sports way. Now add in the potential high rate of positivity of COVID-19. And how many of our students are currently experiencing trauma? How many students do you have where they are out of school for a few days and now are returning to your classroom unavailable to learn? Just like a public health model, we want to support all of our students who struggle immediately in the general education classroom. That's our greatest window of opportunity. But luckily, schools also are obligated to continue to support students through an MTSS or RTI process in your school for those students who struggle longer or more intensely. Because the symptoms are so similar between concussions and COVID-19, so are the interventions, which is why, while we are waiting for more research on COVID, we are applying the tried and true evidence-based academic supports born out of 2 decades of concussion research to return to learn guidance for students returning to the classroom post-COVID-19. When you have a student with cognitive inefficiency return to your classroom, focus on these 3 things in this order. First and foremost, having a student out of school for any medical or psychological reason means that they have missed instruction. So before you can do your brilliant job supporting that student, they must first return to school in their seat before too much time. Therefore, as students who are ill or injured return to school, first provide them a safe, soft place to land. Help them manage their symptoms throughout the day so that they will come to and stay at school. Once your student has heard your instruction, you can then adjust the amount of work that they must produce for you, knowing that they aren't learning information at 100%. And then finally, how can you fairly assess mastery in your student and give them a grade, knowing again that they are not remembering information at 100%. Let's first drill down on mental fatigue. Symptom management is all about energy management. Whenever a student is ill or injured, they don't feel well physically and they don't learn efficiently. To prevent students who feel lousy from being out of school and thus missing your instruction, you first want to be sensitive to how fatigued they feel and how often they feel like they are running on a low battery or on an empty tank of gas. In order to help your students keep physical and cognitive symptoms at bay, allow for more frequent pacing breaks, taking 5 to 10 minute eye breaks, brain breaks, water breaks in the classroom. Or consider a proactive strategic rest break where your student might rest for 20 plus minutes in the clinic or the counseling office, perhaps one time in the morning and one time in the afternoon. Keeping them comfortable and at school as much as possible is the first hurdle to a successful return to learn. Once a student with cognitive inefficiency has been passively listening and learning and hearing your instruction, you can then consider giving them the gift of workload management. But keep in mind that cognitive inefficiencies, whether that be due to COVID or the flu or concussion or trauma, by definition means that your student will not be processing as fast or as well. They will not be able to cover as much territory, so please consider a removal of non-essential work, a reduction of semi-essential work, and focus only on a reasonable amount of essential work. Extensions and postponements backfire with any student with brain fog, as they will barely have enough energy to focus on essential work. They will definitely not have enough energy to make up work and keep on top of current work. Another way to think of this might take you back to your training days when you learned the second principle by Dr. Wilson. Especially with any student who has missed instruction, has had spotty attendance, or feels physically or cognitively unwell, try to remove nice to knows, try to reduce need to knows, and focus primarily on must knows. Here are some ideas for differentiated instruction for workload management. Focus on comprehension instead of memorization, on quality instead of quantity, and allow for supplements. Imagine how grateful you would feel if your boss cut you some slack when returning to work post-COVID or post-flu, post-concussion, or after getting back from a family emergency. These small adjustments and a little TLC will really help your students as they return to your classroom. Teachers like to hold an empty spot in the grade book until work can be made up later. But with brain fog, that work may never be able to be made up, and electronic grades will automatically fall, and this will make the student and parents anxious. We suggest you give your student adjusted work throughout recovery and grade that work fairly. Exempt need to knows and nice to knows for a short time. Keep the grade book populated with adjusted must knows and grades up during recovery. Remember those symptoms of COVID-19 from the CDC? There's another symptom in there that they talk about, post-exertional malaise. That means that symptoms get worse after physical or mental activities. This is a standard symptom with concussion as well. So work with your student on some expectations, but not too many taxing demands. Find the right balance to keep them listening and learning at school without pushing their symptoms too high. Remember, if they don't feel well enough to be at school, they won't attend. And if they don't attend, you can't do your magic with workload management, mastery, grades, and credits. And finally, after a student has heard your instruction and has done some of the work for practice, how can you hold them accountable for grades and mastery? Here are some ideas on alternative appraisals and fair testing. Consider alternative and creative ways to assess for mastery and to give a grade. Perhaps group work or an oral presentation will demonstrate knowledge better in this compromised state rather than through a test. But if a test is necessary, consider supplements to the format and consider generous grading. While you might want to hold back quizzes and tests for the first few weeks of a student coming back to school post-illness or injury, it is perfectly acceptable to ease your student back into tests and quizzes as weeks pass and as they can tolerate. Anytime a student is ill or injured or traumatized, we want to have input from a healthcare provider. Keep in mind though, some families will opt not to see a healthcare provider or not see them frequently throughout recovery. Whether a student sees a healthcare or mental health provider, it is still our obligation at school to educate them the best we can during recovery from their illness, injury, or trauma. Healthcare providers that are too prescriptive in their recommendations can tie our hands at school. Healthcare providers are not well versed in what is feasible in a school setting. Remember, guidance from healthcare providers about academic supports are suggestions, not mandates. The materials you will receive by the end of this training will end up covering more realistically and more relevantly a myriad of academic ideas, and your skill as a teacher allows you to be an expert in return to learn, more than any healthcare provider could ever be. With concussion, while each state has legislation around a safe return to play, you are in charge of your own classroom when it comes to adding in or removing academic supports as you see fit. And likewise with COVID-19, you are the first and most important responder on return to learn. Trust yourselves, you've got this. Front load your supports. Be as generous as you can be with your academic supports in the first week of a student returning to learn post-injury or illness, but slowly, gently begin to pull back every week and test out their ability to tolerate more academic expectations with less and less symptoms as time goes by. After this training, you will be directed to go to your specific landing page. There, you will have access to tip sheets and videos that you can download at your convenience. You will also have access to the Teacher Acute COVID Concussion tool that we call the TACT. The TACT is an electronic survey that takes less than 5 minutes to complete. When a student with COVID-19 or a concussion comes back into your classroom, you will be asked to answer 7 or 8 questions, depending upon what grade level you teach. You will answer questions about how you teach, what you teach, when you teach this particular student, and how much technology and reading you use in your lessons. The TACT will instantly deliver information on these 3 areas: mental fatigue, slow processing speed, and short-term memory into your email inbox. Your TACT email will be color-coded and will align with symptom management, workload management, and mastery and grades. You will receive interventions in the right order with attached tip sheets for 4 weeks total. Throughout the school year, your school nurse or administration should ask you to complete the TACT in real time, just when a student post-COVID or concussion is about ready to re-enter into your classroom. But for today, you will be asked to complete the TACT on the spot for training purposes. That way, you will receive your 4 weeks of interventions provided to you via email to make sure that you have a full Return to Learn toolkit at your disposal for whenever a student with COVID or concussion comes back into your classroom. I would implore you to also think about applying these evidence-based interventions to students returning to your classroom post-trauma, after the flu, after chemotherapy, after a bout with seizures or a new diagnosis of diabetes, to name a few. Okay, now that you know everything you need to know about Return to Learn, are you ready to do the TACT together and fill up your toolkit? Great, let's do it. On your computer or phone, enter the specific Rhode Island link given to you by the facilitator of this training. That will take you to this Welcome Rhode Island Educators Password page. Make sure that you are on the password page like the one that you see on the slide, and that you're not on the general Get Schooled web page that you also see on this slide, but it is X'd out. Then simply enter the password given to you by the facilitator of this training. That takes you to this landing page where you will click on Access TACT. At that point, simply follow the directions. Complete the demographic information. Use only your school or work email address. If this is your first time in the TACT, answer yes and answer the 2 pre-TACT questions. And since you are doing the TACT today for training purposes, simply click on Training. You can then click on Training for COVID, or Training for Concussion, or Training for other medical, psychological condition that causes cognitive inefficiencies. The facilitator of this training will give you your specific link and password again right here. Go in and do the TACT right now so that you can start receiving your 4 weeks of emails and fill up your Return to Learn toolkit. Please do not share this link and password outside of your state. Finally, thank you for your time today and for being the Return to Learn experts that you are.